Hello everyone, welcome to another We Teach MBRU video. My name is Sarah and I'll be covering the 12 cranial nerves, their exit point from the skull, and some of their important functions. Before we begin, I'd like to highlight two mnemonics that have helped me remember the order of the cranial nerves and their functions. The first one is, only one of the two athletes felt very good, victorious, and healthy. This is to help me remember the order and names of the nerves. The second mnemonic is, some say money matters, but my brother says big brains matter most, where the first letter of each word is either S for sensation, M for motor, or B for both functions. Remembering the names of the cranial nerves and their modality of innervation makes remembering the functions of these nerves easier. The first cranial nerve is the olfactory nerve. It exits from the cribriform plate and is responsible for the sense of smell. The second cranial nerve is the optic nerve. It exits from the optic canal and is responsible for the sense of vision. The third cranial nerve is the oculomotor nerve. It exits from the superior orbital fissure and is responsible for the motor function of four extrinsic eye muscles: superior rectus, inferior rectus, medial rectus, and inferior oblique muscles. It also innervates the levator palpebrae superioris and pupillary sphincter. The fourth cranial nerve is the trochlear nerve. It also exits from the superior orbital fissure and is responsible for the motor function of the superior oblique eye muscle. The fifth cranial nerve is the trigeminal nerve, and it has three divisions. The ophthalmic division exits from the superior orbital fissure, the maxillary division exits from the foramen rotundum, and the mandibular division exits from the foramen ovale. Visualizing the three divisions using this image and knowing the derivative of the name of each division helps me remember what they innervate. For example, the mandibular division reminds me of the mandible, which I know is important for chewing. So, the mandibular division is responsible for the motor function of the muscles of mastication. The sixth cranial nerve is the abducent nerve. It also exits from the superior orbital fissure and is responsible for the motor function of the lateral rectus muscle. If you noticed, some of the cranial nerves we've covered so far are involved with the ocular muscles. A mnemonic I like to use is SO4, LR6, I3, which reminds me that the superior oblique muscle is innervated by the fourth nerve, the lateral rectus muscle is innervated by the sixth nerve, and the rest of the eye muscles are innervated by the third nerve. They all exit from the superior orbital fissure. The seventh cranial nerve is the facial nerve. It exits from the internal acoustic meatus and has branches that are responsible for sensation of parts of the external ear, taste from anterior 2/3 of the tongue, and motor functions of muscles of facial expression, along with glands of the mouth and nose. The eighth cranial nerve is the vestibulocochlear nerve. It exits from the internal acoustic meatus as well, and as its name suggests, is responsible for the sensation of hearing and balance. The ninth cranial nerve is the glossopharyngeal nerve. It exits from the jugular foramen and is responsible for both sensation of posterior 1/3 of the tongue and motor function of the parotid gland and stylopharyngeus muscle. The 10th cranial nerve is the vagus nerve. Now this is a big one. It also exits from the jugular foramen and is responsible for sensation and motor function of the pharynx, larynx, smooth muscles of the GIT, heart, and lungs. The 11th cranial nerve is the spinal accessory nerve. It exits from the jugular foramen and is responsible for the motor function of the trapezius and sternocleidomastoid. The 12th cranial nerve is the hypoglossal nerve. It exits from the hypoglossal canal and is responsible for the motor function of the intrinsic and extrinsic tongue muscles except the palatoglossus. Any damage to these nerves often results in loss of sensation or paralysis to whatever they innervate. For example, if a patient presents with loss of hearing, part of your differential diagnosis would be to look for something that is affecting the cranial nerve associated with hearing. In this case, it would be the vestibulocochlear nerve.